You're watching Arab Health TV, and this conversation is going to be about preventative care and preventative medicine, and we're very kindly joined by Dr. Richard Marshall, who is the CEO of Juvenescence. Thank you very much for joining us today.
It's a pleasure. Thank you for having me.
So what brings you to Arab Health, and what partnerships are you looking to explore?
Well, thank you. And we're an unusual biotech in some ways. Our mission is to extend your healthy lifespan, which means the number of years of your life you spend in health. Unfortunately, too many of us succumb to many chronic diseases as we get older. So we're trying to develop medicines that you can use in prevention. You could start to take them perhaps at the early stage of a disease or when you are at very high risk of a disease and prevent the disease before it even happens. The UAE is a great place for us to partner and work for a lot of reasons. Firstly, it's a country that's really been built on innovation. Secondly, in the healthcare sector, and of course we're here at an incredible meeting this week, you have such a close connection between all of the elements you need to make medicine. So you have good science, you have good digital health infrastructure, you have good healthcare infrastructure, and also importantly now, in this new era, you have really important data science. So important to us is to use artificial intelligence as much as possible to help make our medicines more efficiently, so as quicker as possible, so we can get them to patients as soon as possible. And all of those things come together in the UAE. So we've been building partnerships here over the last couple of years to really bring our expertise in how to make medicines, and we have a huge expertise amongst the team, together with all the great innovation I've just mentioned in the region.
What's the new things and new trendy conversations are? There's biobanks, and you've also got the genome projects. How innovative are they, and where do you see this growing?
They're well leading. I mean, this is really important to have data. We know now that with the tools that artificial intelligence and machine learning models can deliver, but they need data. So genetics, what our DNA and what makes us who we are, that's super important. But you also need to look at all of our biology, not just the genes. So the biobank, where there are collections of other samples from patients, is important. And then also what you need to do is link that genetic information and that biobank information with something about people's health. So for an individual person, you know a lot about their genetics, a lot about what makes their biology work, but you also know where they are in their healthcare journey. And again, triangulating and bringing together all of those is going to be super, super important.